Hello everybody, I am Dr. Jasneet Kaur. I am a consultant at Millen Fertility Center, Chandigarh. Today we will be talking to you about low AMH and fertility. Now we decided to talk on this topic because of the present corona pandemic, in which we are trying to prioritize our ART services, and patients with a low AMH are definitely a top on our list. So then, coming on to, before starting the talk, I'd like to give a brief introduction of what a women's ovarian reserve is. So basically, all women are born with a fixed number of eggs. So at birth, a girl child has around 1 to 2 million of these eggs. And as a woman ages, there's a decline in both the quantity as well as the quality of these eggs. Now this decline becomes more rampant at the age of 32 to 35 years. In fact, studies have shown that the ovaries of Indian women age 6 years faster than the Caucasian counterparts, which in fact is a little worrisome. On the other hand, men are luckier, and for them the production of sperms is a continuous lifelong process. Now, talking about AMH. What is AMH? AMH is basically a hormone which is produced by the cells which are surrounding an egg, and it can be measured at any time in the menstrual cycle, and it gives us an idea of what is the ovarian reserve like in a woman at a particular time, which means how many eggs does a woman have at a particular time in her life. Now the normal AMH value is in the range of 2 to 3.5 nanograms per ml, and women who have an AMH of less than 2, particularly less than 1.5 nanograms per ml, are labeled as having a low ovarian reserve. Now AMH needs to be measured in a reliable lab, because the earlier AMH assays that were used were basically manual assays and not very precise, and now we've come up with automated AMH assays which are more precise, more accurate and more reproducible. So it is very important that a woman gets her AMH done from a reliable laboratory. Now another thing I'd like to touch upon is that there's a common myth that if a woman has a low AMH, she cannot have a spontaneous conception or she cannot conceive on her own. Now to explain this concept, I'd like to bring about something known as, we all need to understand what is fecundity. Now fecundity is the chance of a woman conceiving in a natural cycle. So for a woman who has a normal ovarian reserve, for whom everything else is normal, her chances of conceiving per cycle are only 15 to 20%. Now women who have a low ovarian reserve, their probability of conception in one cycle goes down to say 10%, 5%, depending on what her ovarian reserve is like, but it is never 0%. So we all need to understand this, that a low AMH does not mean that a woman cannot have a spontaneous conception. Now to elaborate all this further, I'd like to take in a few cases that we commonly encounter in our day-to-day practice. So first, we come across women who are young, say 23, 24 years old, who've been recently married for 2 to 3 months, and they come crying to our clinic with an AMH report of say 0.8, 0.9, and they say that somebody's told us that we cannot conceive on our own because my AMH is very low, and please do an IVF cycle for me, or at times worse, do a donor egg program. So here, we'd like to tell everybody that women who have a low reserve and who are recently married, please, you should not panic. Having a low reserve doesn't mean that you cannot conceive. What it means is, yes, that your window of opportunity is definitely narrowed, and we need to fasten your process of conception. So basically, we need to ensure that you conceive at the earliest possible time. So we start with simple monitorings. If they don't work out for you, we give ovulation augmentation agents. We can sum it up with an IUI cycle, and if all these simpler treatments don't work for you, then we move you towards an IVF cycle. At the same time, I'd like to emphasize that moving towards an IVF cycle at the right time is also very important, because the success of an IVF cycle depends on women's age as well as the number of eggs that we retrieve in a particular cycle. Now the second common clinical scenario that we encounter is young women, say 28, 29 years, who have a low ovarian reserve and who are not contemplating on starting a family soon. Maybe they've not found the right partner, they've not got married, or even if they've got married, they are planning to postpone pregnancy. So for them, we tell them that if you have a low ovarian reserve, time is of big essence for you, because your AMH is going to fall down as you age. So either you should plan on starting a family soon, but if you do not want to do so, then you should get your eggs or embryos frozen, so that it is a kind of a fertility insurance. When once you get married or once you plan to start a family, at that time you can try naturally, but if you fail, then you have something to fall back on. Third is a category of patients who have, who are maybe older in age, say 35 plus, who have a low ovarian reserve, who have tried all the simpler treatment options, but nothing seems to work for them, and they are insistent on trying naturally. So for them, we'd like to say that please do not waste more time. IVF is the quickest way of having pregnancy. It is a way in which you can decrease your time to pregnancy, and if you are going to, wait longer, then your ovarian reserve is going to go down, your egg quality as well as your egg numbers are going to go down, and so you will not hold a very good chance even if an IVF cycle. So even in IVF cycles, success depends on both the egg numbers as well as the egg quality. So with age, the egg abnormalities are going to increase, and so your chances with IVF will definitely be lesser in comparison to women who have a normal ovarian reserve. So also, we've seen that patients who are younger, who go into an IVF cycle with a lower ovarian reserve, fare better than women who are older and who have lesser number of eggs. So in women who have lesser number of eggs, we also give them the option of embryo pooling, in which they undergo multiple IVF cycles and then we pool in the embryos so that we are able to generate one competent chromosomally normal embryo. Then, another important question that people ask us is there any medication which can help me increase my egg numbers? So here I'd like to emphasize what I've already mentioned, that all women are born with a fixed number of eggs, and this is an irreversible process. We cannot reverse the process of biological aging. Yes, we do have agents like DHEA, androgens, and melatonin, and antioxidants like CoQ10, but basically what they do is maybe increase the recruitment of some eggs in one particular cycle, or they might help to improve the egg quality a little bit, but this is what we have to offer, and it is all given empirically. Now with advancements in science, we have also something known as ovarian rejuvenation, in which we basically put in PRP or stem cells inside the ovary so as to increase your ovarian reserve, but it also helps only 5 to 10% of the patients only. So I'd like to sum up here that yes, if you have a low ovarian reserve, please do not think that you cannot have a spontaneous conception. Yes, you have a limited window of opportunity. You need to fasten the process of conception, move in a step ladder approach, start with simpler treatment options. If they do not work for you, only then move towards IVF. On the other hand, if you are younger with a low ovarian reserve and you are not contemplating on starting a family soon, then getting your eggs or embryo frozen is not a bad option. On the other hand, if you are older and you have a low ovarian reserve, simpler treatment options have not worked for you, or even if you are younger and simpler treatment options have not worked for you, then it is time that you move towards IVF, because that is the quickest way of achieving the pregnancy. Thank you so much for your patient listening. If you have any questions, you can please write them down to us. Also, I'd like to say all of you, please take care during these hard corona times. Stay home and stay safe. Thank you.